Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's move on to the understanding the radial nerve. So radial nerve injury. So under the radial nerve injury, there are classified into three. So this is very high, second one being high, and third one being a low lesion. So now let's break it and understand each of them. So first one is very high. So by very high, the cause being it is around the shoulder. So this is around the shoulder, as well as the shoulder joint dislocation, as well as the crutch palsy. Next is we move on to the motor manifestations. So under the motor manifestation, it is the inability to extend the elbow. So the individual in a high lesion is unable to extend elbow. So can't extend elbow. Next one being the patient is also presents with the wrist drop, the thumb drop, as well as the finger drop. Okay, wrist drop, thumb drop, finger drop is same. Next, moving on to the sensory lesion, sensory loss. So under the sensory loss, it includes the over the dorsal aspect. So this is seen over the dorsal aspect. So under the dorsal aspect of the anatomical snuff box, so this is anatomical snuff box. And also sensory loss is seen in the lateral half of the hand. So lateral half of the hand is seen. Next is also the lateral 3.5 digits till the DIP. So lateral half of the hand is seen, the sensory loss, as well as the lateral 3.5 digits till the DIP. So this was all about the very high lesion. So to summarize some important points, the very high lesions, it involves nothing but the shoulder and also the shoulder dislocation as well as the crutch palsy. The motor manifestation, it includes the wrist, the thumb, as well as the finger drop. And in sensory, there is a anatomical snuff box, which is there is a sensory loss as well as lateral half of the hand and lateral 3.5 digits, and this is still the DIP. Now we move on to the high lesion. So the high lesion, what is the cause of the high lesion? The cause of the high lesion is, it is humerus fracture. H for high and H for the humerus fracture. So this again, it presents with the wrist, the thumb and the finger drop. And then moving on to the sensory loss. Sensory loss is over the dorsal aspect. So this is over the dorsal aspect. So the dorsal aspect of the anatomical snuff box, this is similar. That is anatomical snuff box. Next, lateral half of the hand, as well as the lateral 3.5 of the digits till the DIP. So to quickly recap, the high lesion is H for high, H for humerus fracture. And as you know, the motor manifestation, wrist, thumb and finger drops. And over the dorsal aspect, there is a anatomical snuff box where the sensory loss as well as the lateral half and lateral 3.5 digits. And this is still the DIP, dip. Now we move on to the low lesion. So what about the low lesion? The low lesion is the cause being the elbow fracture and the elbow dislocation. So H for humerus. So when you come down the humerus, we have the elbow fracture. So it involves elbow fracture as well as you can call it as the elbow dislocation. So what does this involve? So we saw the wrist being present, wrist drop in the very high and high lesion. So here we have only the thumb and the finger drop. So the wrist is not present. So wrist is not present, only the thumb and the finger drop are present. And talking about the sensory loss, what about the elbow dislocation? We do not have any sensory loss. So now let's quickly recap the lower lesion. So lower lesion, as we discussed, it involves the elbow fracture or the elbow dislocation, and it results in the thumb and the finger drop, and there is no sensory loss. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.